I'm Ronald Duncan. I'm Chairman and CEO of Cloudbuy, and I'm here to try and explain how we're delivering personal budgets for the NHS with NHS Shared Business Services.
Hello, I'm Benjamyn Damazer. I'm Head of Commissioning for NHS Shared Business Services, working with Cloudbuy to try, as Ron just said, to work how we're going to deliver personal health budgets for the benefits of patients and commissioners.
So perhaps you could tell us a bit about personal health budgets and sort of the challenges around that and what you guys are trying to do to transform that.
Okay, everybody will have heard of this government and previous government's intention to increase patient choice. One of the things that's happened in health is that the health industry has decided what patients need, and personal health budgets are a step on the path to increasing patient choice. Where they have typically long-term conditions, the idea is that if the patient is in control of a dedicated budget for them, for themselves, they can choose best how to implement the healthcare package which is right for them, working in conjunction with the professionals. But they would have the budget, they can procure the services, the care, the support, the activities, the equipment that they need to improve the quality of their lives, and ideally to keep them out of institutions.
So is that something that's not been possible previously, and it's sort of a new thing that the NHS is doing?
It is new. What's happened before is you go to your GP and the GP refers you to a large number of agencies. You need to go and see the orthopaedic department about your dodgy hip. You need to go to a different location to see the ophthalmology team about your cataract. You need to go somewhere else for your care because you need help at home. You go somewhere else if you need respite care. And it's all very piecemeal, very fragmented, coordinated through the GP, but actually often in real terms not coordinated. And particularly where there are short-term issues. You need respite care, you want to change your care plan, you want to go away for a fortnight, you now don't need the care, you're off to see your daughter who lives halfway across the country. It's all been possible but very difficult.
And it sounds like there's real opportunities here for the patient in terms of getting control. How difficult is it for the NHS to do this? I mean, what challenges does that present?
There are, I think, three challenges. The NHS is, because it's public money for reasons that we all well understand, is risk averse. And the idea of saying, here you are, Mr. or Mrs. Patient, here's a pot of money, go off and spend it. The risk that they say, I've not got long to live, let me drink as much as I can and smoke as much as I can and go to bingo as often as I can in whatever time I have left. The NHS is not encouraged and is not encouraging that kind of activity. So the risk is that the patient will misspend their money. So that's one part of it. Second part of it is for the commissioners to keep control of what you actually do. So let's assume that you are a reasonable patient, you're in control of what you do, you actually want to do the right thing. The NHS still has a responsibility for ensuring that it understands where the money has gone and matching those against the desired outcomes for the patient and actually balancing those. So there's a challenge there. In one is how do you let the patient have the choice, but how do you actually monitor and not micro-control and micromanage, but control in a general sense what the patients are doing to ensure that the patients are getting the clinical health, lifestyle outcomes that they want and need.
And how are you sort of seeing that playing out? Is it working?
It's actually kind of a groundbreaking challenge, because what you want to do to make it work is you've got the NHS, which is a great big buyer, and it's actually buying all this stuff on behalf of the patient, but you want to give the person the choice. And so what you've got to do is try and make sort of procurement easy enough that somebody who's on long-term care can just buy the stuff themselves. So it's making it very easy for them to buy the right things, and that the NHS centrally negotiates, the care home, the disabled living aids, the other bits and pieces that make up their care package. So you actually get all these things being delivered at NHS prices, and so the NHS keeps the savings on its bulk buying, but the person having the individual choice as to which items they get, how they get delivered, and everything else. And it's important from a sort of an outcomes basis, where if the person keeps their own choice, it actually makes them feel more enabled and still in control of their lives, as opposed to suddenly they've become, they're now in in the NHS's control or social services control. And the other aspect of this is the joint working between health and social services, because most of these people will require a bit of social services, a bit of health, and it's bringing the two budgets together in an accessible way that makes it easy for the patient to do it, and also takes away all the admin, because if you're caring for yourself, you're clearly in a situation where you don't suddenly want to have to add up all these expenses and report back on them and make sure you've got all the budgeting correct. And so what we're trying to do from a technology purpose is make it very easy to use, automate all the admin, whilst keeping all the sort of controls that an organisation like the NHS needs to have for spending public money.
And I suppose the cloud is sort of in a prime position to do
Yeah,
that.
because it acts as that step between the core NHS systems that NHS Shared Business Service run and making it easy for the individual carers and providers to come on and provide care and interact in a sort of seamless manner with the actual patients.
And is this sort of being done at a national level, or are you sort of trialling it locally? How's the
Well,
approach?
the way in which the NHS works is each clinical commissioning group is responsible for deciding which patients get personal health budgets and how much they get and what the care plans should be. Each individual bodies will make their own decisions. What we're looking at is a common solution that is available to everybody everywhere, because of course you also have the issue that patients move around. Now, clearly, the older they are, the less likely they are to move around and very far, but mum who lives in Norfolk goes to live near daughter in Northumberland, doesn't want radical and dramatic change to the structure of her care package. Her hip doesn't suddenly get better and her eyes suddenly come up with a different prescription. You want continuity of care, continuity of a care plan, and clearly the more widely adopted the personal health budget through an e-marketplace model is adopted, the easier it will be for people to move around.
So what sort of stage would you say we're at now with this?
We're at the stage where shared businesses run the finance and accounts for all the bodies. We've got the marketplace up and running for local authorities, and we're just getting it ready as the next stage for the NHS, because the NHS is following the local government in this space. So we've got all the technology together. It's just how we roll it out through the different groups.
And sort of a last question for you both. Over the next couple of years as this plays out, what do you sort of anticipate being sort of the main challenges you'll come up against, and sort of how do you hope it'll eventually play out?
I think the main challenge is going to be the very low-level challenge. If you take a patient who has care, that will range from an institutionalised care home that has processes and systems and a booking application and whatever to get the patient in, through to the patient that says, I need somebody to come in for a couple of hours a week to mow my lawn and look after my flower beds. Now, that's not a national provider, that's not a big agency, that's Bob up the road that comes in and does that, and I need to pay Bob. Actually managing that end of the spectrum, where Bob is not used to raising an invoice or putting in a payment request and responding to a tender and a purchase order, but Bob does valuable work for Mary of actually getting all that to happen in an environment where the CCG, Clinical Commissioning Group, says that's a legitimate use of that money to enable Mary to stay in her own home. It's the mindset change and challenge that I think is going to be required.
Yep, I agree that you've got that mindset change. And we've been through this already with things like starting up small businesses. We've now formed almost 300,000 small businesses. So we're used to doing that sort of thing in volume. And we put on thousands of care providers for local authorities. But it's that national system where you've got people that they're either not used to setting up a business, or they've run a small business before, but you're having to do that mixture of the guidance for the provider as to how you actually act as a small business that cuts lawns. And it may be that is your full-time business, or it may just be that you've decided to cut your neighbour's lawn, twice a week as a favour, but they want to pay you. And so making it easy for those both parties to actually do business in a way that's legal and fits in with sort of NHS guidance. So it's just trying to smooth all those things through, and I think we've got the sort of technology bits. But I know that on the people bits, there's still going to be quite a lot of work there to help people through the process and everything else.
Okay, brilliant. Thanks very much, guys.
Thank you.